What are the benefits of Velcade SubQ injection?
The major benefit of giving Velcade subcutaneously is that it produces less neuropathy. There's less impact in terms of nerve damage. The reduction in neuropathy with the SubQ Velcade is a very, very important development for patients with myeloma. There are patients where it's difficult to find a vein to give the intravenous injection. And so for this kind of a patient, which is not uncommon, it can be helpful just to give the Velcade subcutaneously rather than struggling to find a vein. It's obviously a lot easier to go in and get the SubQ shot versus taking time for the nurse to help find a vein and set up the intravenous infusion.
When Velcade was given as an injection subcutaneously, a lower percentage of patients develop the neuropathies. An IV is sometimes hard to start. The nurses usually given the medicine, they have a hard time finding a person's vein. So as you give it as a shot, you don't have to deal with that problem.
The key differences in administering Velcade intravenously versus subcutaneously is the fact that with an intravenous injection, you're going to have an IV catheter placed. And that can be painful for people. That can also be time-consuming. Patients may want to receive subcutaneous Velcade because it is probably going to be associated with less time spent in the clinic, as well as the fact that you will not need to have an intravenous catheter placed.
Giving an injection is a lot quicker than starting an IV. Sometimes our patients are getting stuck 3 and 4 times trying to find that vein. And over time, that gets on people.
What is the efficacy of Velcade SubQ injection?
The surprising thing is that the SubQ injection has produced equal results, both in terms of the percentage of patients who respond to treatment, plus the depth of the response.
When Velcade was compared in this pretty large study done in Europe, where they compared the intravenous way of taking Velcade to the subcutaneous shot with Velcade, the effectiveness was identical.
Should a patient take Velcade intravenously or subcutaneously?
The decision on whether you should give it intravenously or subcutaneously is up to the patient, the nurse, and the doctor.
The healthcare provider, either the physician or nurse practitioner or physician's assistant, that is going to decide to administer Velcade subcutaneously.
Where is the Velcade administered subcutaneously?
The shots where Velcade are administered in a patient usually are either in their abdomen or in their upper thigh. And usually they get rotated, so you're not just given the shot in the same spot over and over again.
And that's an injection that's under the skin. And it's given exactly the same schedule as how it's given intravenously, except the route is different. The preferable areas would be to the abdomen or the thigh. And with each injection, you would need to change the area that it's given and not give it in exactly the same side from dose to dose.
Velcade is given in the subcutaneous tissue. We typically do it in the abdomen. You've got to change your sites. You've got to rotate it. There can be a little bit of skin irritant, so you never want to go with the same place.
What were the results from the Velcade SubQ injection clinical trials?
The study that was done in France was a randomized study where half the patients received the Velcade intravenously and the other half received the Velcade by SubQ shot. And the outcome, the percentage of patients who responded was virtually identical, and the response duration and the overall survival was equal in both arms of the study.
What they found in the clinical trials with the SubQ versus IV is that the benefits were the same. It worked just as well. But what they found was less side effects such as peripheral neuropathy.
Who is Velcade SubQ injection indicated for?
Velcade is indicated for patients with multiple myeloma. It can be given as a frontline treatment for patients that were previously untreated, as well as for patients that have relapsed or progressed.
Can a patient give themselves a Velcade SubQ injection at home?
Currently, the recommendation is that subcutaneous Velcade is not administered at home. Patients need to have their lab work evaluated before each dose of Velcade is given.
Patients right now cannot administer, it is a chemotherapy. It should be given by a registered nurse.
Is the Velcade different when it's administered as an injection versus an IV?
Whether you administer Velcade intravenously or whether you administer it subcutaneously, it is the same drug.
Often patients get very worried about thinking that IV medications must be the stronger medications. Just because a medication is a different route doesn't mean the medication is stronger, works differently. We think Velcade, SubQ, and IV work the same.
Do patients have to have their lab work done before receiving a Velcade SQ injection?
Before you receive Velcade, whether it's intravenously or subcutaneously, you need to have lab work checked. And the reason why we check your labs is to make sure that your white blood cells, your red blood cells, platelets are adequate, as well as some of your chemistries are also in balance.
What are the side effects of Velcade SubQ injection?
Occasionally with subcutaneous Velcade, patients will experience skin irritation.
Velcade given as an injection can irritate the skin. It can be redness, it can be sore, but in general, if you rotate the sites, it will be more helpful.
Does Velcade SubQ injection still have the potential to reactivate the shingles virus? Does the patient need to take an antiviral?
Anyone on Velcade should always be on an antiviral. It still works the same way, and it can reactivate that shingles virus.
Is the concentration of Velcade different when administered by SubQ injection rather than IV infusion?
The concentration of the SubQ, it's more concentrated versus the IV. The SubQ will, because it's more concentrated, you'll have less amount to inject versus giving it IV.
I just go in and I have my blood checked, and when it's approved and the orders come in, the Velcade is just given SubQ in my stomach, and I'm out of there. No time at all. I was just delighted with the news of the SubQ and the thought of not having to waste 4 or 5 hours sitting in a chair all afternoon. I think SubQ is a big turning point for a lot of people who are, afraid of going in and having their veins accessed.
It's much easier to get a shot rather than IV. I have very small veins, and your arms are just become a mess, and so this is much better. I don't worry so much about getting neuropathy because of the way I'm getting the Velcade shot. It means that it's one less thing I have to deal with. I think that getting Velcade subcutaneously enhances the quality of my life. Anything that's going to help you reduce neuropathy is a big deal for any patient. When you don't have to deal with neuropathy, you have one less thing that you're worrying about and one less thing that affects the quality of your life.
I just have no side effects. It's fast, it's easy, and I get my injection of Velcade and go home. I can just live a normal life. Is such a great feeling. I mean, it's not a cure, but it certainly has helped quite a bit.
When getting the Velcade subcutaneous became an option, I was looking forward to not getting poked and not putting that extra pressure on my veins with the chemicals. I'm so happy to have a shot instead of having my veins poked. Being able to have Velcade subcutaneously has been a terrific thing for me because psychologically, being able to just get shots and take my other medications by pills, I don't feel that I don't feel like I'm a sick person.